All right, thank you all for, well, you're here. We're here. I'll start with a quiz. What is the largest industry in San Francisco? It's an easy answer, considering the conference you're at. Healthcare. Thank you. It is, in fact, 122,000 people in San Francisco are employed in healthcare. Nationwide, it is 20 million Americans, which is 15% of the workforce. So, and physicians are a tiny fraction of that, right? They are minuscule compared to the legion of nurses and administrators and home healthcare workers, all the other people who are actually delivering healthcare in the United States. And so what we're going to talk about today is three awesome companies who are doing new things to basically make those services and make those people even more efficient and more effective in their jobs. It's the combination of software and physical services that is driving change in a lot of industries, and now healthcare. It is a great honor to be. I mean, they're really stupendous companies. We have Thea Runyan from Kurbo Health. She's the co-founder. We have Sandy Jen, who's co-founder of Honor, and Alejandro Foung, who is co-founder and CEO of Lantern. And what I'm going to do is let them describe to you all what they do, and then we're going to get into the demand, the kind of optimization that they're doing around this distribution of labor. So Thea, why don't you start?
So yes, I'm the co-founder of Kurbo Health. I'm head of content and coaching for the company. And our product is a mobile app and weekly coaching with a Kurbo coach. Our mobile app has a whole bunch of behavior modification tools built in. It's a very robust app with tracking foods and exercise, goal setting, things like that. And then, like I said, weekly meetings with the Kurbo coach. We license the program from Stanford University, which has one of the leading pediatric weight control programs in the country. Our goal after licensing this great, fantastic offline program was to take these best practices from all these amazing programs across the country and build it into something, use technology to blow it out, to really be able to reach the millions and millions of kids and families that need to work on weight management and lose weight. So that's the plan, to help as many people as we possibly can.
Go ahead.
I'm Sandy. I'm one of the co-founders of Honor, and Honor's mission, I think the last conversation spoke to it, is to help our parents stay at home. We have many, many seniors and a growing population of seniors in the United States and internationally, and we have done a very bad job of taking care of them. The industry has not changed in 20 to 30 years. It's very stagnated, very fragmented, and so our goal is to bring scale and innovation and sort of what we call joy, comfort, grace to a landscape that is usually fraught with negativity and fear and abuse. And so we are based here in San Francisco, and we love what we do, and our hope is to help every one of your parents, and hopefully ourselves when we get to that age.
Alejandro?
I'm Alejandro at Lantern. We do emotional wellness, mental health on the go. We combine personalized programs that focus on things like stress management, anxiety reduction, and pair that with a real person on the other end who's a professional coach. Could be a PsyD, MFT, master's level health coach to help you kind of center yourself and find that balance on the mind part of having a healthy body and healthy mind.
Cool. So one of where I'd like to start is thinking about something that we actually talk about a lot at Iodine, which is part of what we're trying to do is to make the human parts more robotic, or in some sense more like algorithms, and then make the algorithms seem more like humans. And I wonder how each of you kind of has decided where to draw that line. Like how have you decided to deploy, to do certain things automatically through software, and then deploying the human touch at what point? Was that just intuitive? Was it obvious? Or is there kind of a gray area there that you've had to draw the line? Why don't we start with you, Thea?
Testing. So when we first started Kurbo, we really tried to experiment with trying to do text only to see how that would work. And knowing that we wanted to pursue health coaches as well, we experimented a lot. And for us and our audience with kids, we found that face-to-face was critical to their success. So that's really where we decided to focus on the personal attention through those weekly meetings, but we've really spent a lot of time streamlining those practices to make it really efficient and effective in a short amount of time to allow us to scale.
Ours was pretty obvious. In the home care industry, this is going to scare you. Most of the things are done on pen and paper. Care providers who go to homes usually call an agency in the morning and ask them where they're going. There's no getting sick. Like there's no, hey, I can't do this. And so you have people who are underpaid going into homes that are very vulnerable and using no technology. So things like scheduling, things like, price management, things like payments, all that stuff right now is done manually. There's literally a person who sits in an office who does all the scheduling because she understands or he understands who the customers are and who the care pros are and how to do the matching. It is a human brain doing that. There's no reason why that has to happen. And so the industry itself suffers from lack of scale, and if you have a technology platform who can take care of all that, you can benefit from a lot more scale. You can have care pros who have a specific kind of skill set match with a senior with a very specific set of needs, because as all of you know, your parents are very special. Everybody's heterogeneous. It's not a very bucketable industry. And so for us, it was just take them all down and see what we can do. And so far, it's been really, really interesting.
And I think the way that we've been thinking about this is how do we bring data where there isn't data today? And in the field of mental health, if you go to the best behavioral health clinic in the country, they likely don't have a ton of data on the efficacy of the mental health professionals that work there, nor the outcomes of the patients that are attending that center over time, and maybe sporadic information here or there. But because Lantern provides these cognitive behavioral therapy tools where we get, a rating of where, and all this is self-reported, but where you are before and after technique and sporadically throughout the program or at every touch point in the program, we're really starting to map out data where there was not. So seeing where there are these self-reported symptoms of how did this breathing exercise affect my mood, irrespective to what else is going on. So how do we take these inputs and show them in a way to make more efficient those care providers, so we can allow the people to do and make real connections, which is what people are great at doing. And then what can we use on the technology side to automate or display information that allows for better and more efficient care. So it's finding a balance, honestly. Like, I wouldn't say that. I mean, we certainly haven't figured out that exact right, but it's really trying to find the right combination between technology and human services.
I think what he says is really true, is that you need to use technology to make sure that the human part is even better. Like, don't bog down the human with all the stuff that they don't have to do. If you can create a system in an environment where they can thrive, then they can be really, really good. And then you don't have to worry about all the other crud that they have to go through.
For us too. So we really streamline the whole back end using technology so that when the coach is coaching a kid, that's all they're doing. So trying to make that as simple and as efficient as possible has been a really important focus for us.
So let's talk a little bit about the recruitment and kind of the process of bringing these experts, these coaches, or the you don't call them coaches, you call them
Care professionals.
Care pros, right? How do you recruit them? How do you train them? All that stuff. So it's hard. It's not centralized, right?
It is kind of hard. I mean, part of it is that the care professionals that we have, they could be PsyD, marriage and family therapist, licensed clinical social worker. They could be a lot of different things. I think part of it for us is who is comfortable in the modality that we're delivering care. So specifically, it's phone, it's looking at a web interface, and then it's primarily having 90% of the interaction via text message. So who has the training, that has familiarity with CBT, is comfortable delivering care in this modality, and that's kind of our process, is one, finding the core subset of people that can deliver the skills, and then two would be who can we train on our tools that can deliver the service that they know how to do in this mode.
I think for us, it's actually the sort of profession of caring for others is one of the fastest growing professions in the country. It's just the need for them, given the growing senior populations, is exploding. And so for us, it's actually finding the really good ones versus just any ones, because there are 2 to 3 million of these workers out there anyway. But if you ask an agency right now who's good, they have no idea. So as Alejandro said before about collecting data, understanding what makes a great care professional, what makes one work on this platform, what makes them able to provide great care versus okay care. And so finding that right balance and then integrating that feedback loop back into your recruitment process is really important. And I think that's not possible without some sort of technology platform, learning adaptive technologies to be able to do that. And that's something that I think all of us bring to the table.
So like Lantern, we also employ a lot of coaches from different backgrounds. I think first and foremost, we really look at their connection to kids and their experience with kids. You could be the best RD in the world, but if you don't have experience working with kids, it really doesn't matter. So that's a really important part. So we also have a lot of teachers, a lot of people that have been teachers, RNs who really want to work directly with families. So we've been able to find a lot of people like that out there who want the flexibility of the workday that we have. They can work from home. They're all around the country. So we've tapped into this great resource. We also, for scale, we recently started working with Humana. So another way for us to scale is to work with insurance companies like Humana that have their own health coaches on board.
And the coaches are often, I mean, they're the human face of the company, right? So they are, in many ways, your brand. What are the challenges about that? What are the challenges about establishing trust, making sure the consumers or the users trust your coaches, but then also making sure that the coaches are viable brand partners?
So important for us. These are coaches working with your kids. So trust is huge. I mean, that's so important for us. So we do background checks. They're all mandated reporters, and we spend a lot of time screening them and training them to deliver our service. But yeah, we take that very seriously.
And for us, I mean, I think the stereotype is that seniors don't trust technology, and so we can't come out as a tech company. You have to be a human company. You have to be a services company, and so the number one thing that gets people to stay with us is the human face. They love their care pro. They love that the person cares about them. They love that there's a relationship, and I think the important part there is that relationship word, where technology, for all its great benefits and innovations, it can't replace a human bond. And so what we try to sort of have is technology fade away into the background so that the relationship, the human-to-human service, the person that really cares for your mom or your dad can be that best person they possibly can. And so the line where we draw is that whatever we do, whatever we create, has to make sure that service is fantastic. Because if the person going in to deliver care is not good, it doesn't matter what the technology does. That face is the brand. If that's not good, it's not going to work.
Yeah, and the on-demand within healthcare is just very interesting, right? Because it's not like, okay, here are your flowers, like you're nice to the person who gave you those flowers, or your lunch, or your Uber driver, or whatever it might be. The service is like kind of what you're eating.
Transactional.
Yeah, transactional. But in healthcare, it really is individual dependent a lot of times, and so I think it is trying to find that right balance and trying to figure out, for us, we've been spending a lot of time thinking about how do we impart our culture and how do we impart the same mode of working with people with this remote force that we're heavily reliant on those individuals in the moment interacting with those clients. So part of the systems that we put in place, and this is where the tools and automation piece come in, is like how can we do our quality audit? So we're kind of looking at the interactions between the various coaches and their users and making sure that they're upholding a high standard. We look at various engagement scores or outcome scores per individual to kind of get a better overall picture using some infrastructure and data so that we're able to have some standard measures in addition to the qualitative measure of like, is this a good coach, user dynamic, and does this represent and accomplish what we want as a brand and company?
So, I'm curious about some of the knobs you're able to twiddle. So for instance, how often do you twiddle your knobs? Yes. Doesn't everybody think about what knobs you have to twiddle? Sorry. Anyway, so one of the, I'm not going to let up on the twiddling. One of the knobs seems to me like how much contact you have with the same coach, right? So it's like you can have constant relationships, or maybe there's other like various coaches. How do you make those adjustments? How do you make those fine-tunings?
For us, you have the same coach. So we have a 3-month program, and you have the same coach. And that's part of the trust aspect. And we spend a lot of time taking a look at the child that's enrolling in the program, what are their interests and hobbies, do they have a male or female preference, and then we match them up. So that creates trust with the parent as well. So we actually care about your child, we care about what their interests are, and we know that if we match them up with somebody with similar interests, then there's going to be a great relationship, which is so important to make change and to be successful. So that relationship is really important.
And for us, the fact that, sorry, I completely lost my thought right there.
It's all that twiddling.
The twiddling. Basically, seniors, like the relationship aspect, the fact that we can provide consistent care pros is actually super important. The number one thing seniors want is they want the same care pro. They don't want someone in and out of their house like, someone cleaning the trash. And so I think one of the benefits of technology is that you can create scale, and with scale you can have backfill. And so let's say that your father is 300 pounds, speaks a particular language, has 6 cats, and is allergic to sesame. There's a specific set of care pros who can service your father. Not everybody can do that. And so with scale, if that care pro is sick, you can backfill him with someone who can do similar things with the same skill sets. But then if you maintain the high quality, you have, again, a great service, high quality, but there's no scrambling to get someone who might be able to take care of your father. And so I think the consistency is really important, but at the same time, you can't have a lot of consistency without a lot of scale in our industry.
Yeah, that's a huge. There's a lot of temptation. For us, the text message service primarily. There's, you could conceive part of the levers or knobs, I guess, that are available is like time to response. So if you didn't have the same individual the same time for every person, you could have a more distributed system, and therefore your time to response for individuals, you could, like, if you had a high value on that, then maybe you wouldn't value one-to-one. In our case, we do one-to-one because we think that there is a really important connection to be made. So we prioritize that, knowing that even if we had a distributed team or anyone was messaging with you, it would be faster. So it kind of is a balance of all these various pieces. But I think specifically for coaching and in mental health in particular, knowing that there's an individual and that person knows you, I think is a huge piece to get improvement and have efficacy.
Okay, so now I have a question, and it's certainly true about Kurbo and Lantern, and perhaps about Honor as well. I'm curious about this thing that we have been talking about at Iodine, which is what we're trying to do is basically to fork the code, which is to say to take things that already work in healthcare and have been systematized and proven and validated, but to fork them in a kind of software environment. And that's very important for people in healthcare because they want everything validated. It is not a natural instinct in healthcare to fork code, right? They want to validate. If you're taking something that's worked someplace else, you have to prove it all over again. And so you know exactly what I'm talking about. So I'm curious about whether obviously you don't say, well, we're just forking the code, but how do you explain to them, how important is it that you're building on validated processes, and how far does that get you?
I have to answer that because I laughed. We still have to. We're based on something that works. We've got, great experience on this, using this application, using the Stanford program, leveraging that, but we still have to prove it. And so we collect a lot of back-end data. We really do. We're able to share a lot of our outcomes. And so slowly over time, as doctors are actually now seeing their patients come in, and the doctor says, "Wow, what are you doing?" And they say, "We're doing Kurbo." So you get that in-person validation, and then we're starting to get enough data to back it up. So it just takes a little bit of time to prove it, but it's also just repetition. Mm-hmm.
I'm going to go slightly on a tangent, but I think it's related, where the fork is more happening in the consumer side, where if you talk to anybody, they're like, yeah, if I could send a person to my dad's house and check on him every 3 days for an hour, that'd be great. And then you say, does your dad need home care? They're like, absolutely not. He does not need home care whatsoever. And so there's a huge disconnect between what is thought of as home care and what we're trying to change as home care. And so I think that's an interesting play where we just have to figure out how to navigate that, because I think I would love to have someone check on my mom every day, but if you were to ask her if she wants, in-home private duty home care, she'd be like, no way. So there's an interesting stigma versus, that balance. And, if you ask them, oh, I'd love to have someone chat with me once a day, sure, but call it home care and it's no way.
Yeah, there's an interesting piece where it's like, what is the consumer? What will they identify with, or what is stigmatized versus what's not? Mental health certainly falls in that. And that's certain. Then what will the buyer or will the entity who's maybe delivering the care, what are they looking for, right? So it's kind of like almost like this double-sided sale where it has to be engaging enough so the consumer will use it, but at the same time, if you're going to sell the health system, do you have a randomized control trial to publish the results and a meaningful result? And so that's the gold standard. And so how do you get around that? I don't know. I mean, I don't think you can. Like right now, I think what's important is as you're building a business is to think about, okay, knowing that the gold standard is the gold standard, how do you have a plan for that? How do you, and then beyond the showing effect and symptom, but is there an ROI on the product that you deliver, and how long will it take you to demonstrate that? I think there's no shortcutting that, because it will take time. It's just time is the only solution there, and execution. So then when it comes down for the entrepreneur, it's like, what is your plan to build a business, short-term, mid-term, such that when you have this data, you can return on it and sell to a large system. And so I think those are the things that you can't really change what a large system will want to see.
Yeah.
And for good reason, right? I mean, you don't want to just try something and deploy it to 10 million people and say, oh, they said they had good data, or they said on their self-reported report, no control.
Well, I was just going to say that for a startup, it takes too much time. I mean, time is a huge problem. I mean, and that's one thing I know with Lantern too, that we built off something that has been proven and works, and then took that and used technology to leverage. So it just takes so much time to provide that validity.
So I want to ask about scale, because I'm curious about obviously having a high-touch human service. You have to scale that up. You have to hire people, and there are limitations there. But there are also advantages of scale in terms of you're distributing the services much more efficiently than you would be if it was facility-based and things like that. So I'm curious about how you kind of surf the problems of scale and how you think through them. I hope that's not too broad, but I hope that somebody having.
I mean, it's like our gross margin. I mean, that's basically what it comes down to. So our gross margin is like, what is the efficiency that we can deliver while holding outcomes and engagement constant. And so for us, that's a key focus. And so we are at a ratio for our coaches to users like 250 to 1, but that presents its own unique challenges, right? Because like a face-to-face clinician in delivering mental health services is not even going to be close to that on a monthly basis, let alone a weekly basis. So that's where technology again needs to play a role. What are we presenting as on Lantern's side? The key for us is that we have people interacting with these online mobile-based programs. So what data are we representing to the coaches so that they have enough context to allow for meaningful communication, timely communication, et cetera? And so that's kind of the essence of what we need to figure out. But absolutely, like scale is like that's whether we make money or don't make money.
I think for us, the scale aspect is what makes us different and what makes us the goal for us to change the industry. And so, for example, right now, home care in general is hyper-local, not scaled, no innovation, and they require things like, I can't get someone out to my dad's home for an hour. This is not possible. I can't convince a care pro to go out for an hour. I have to have a minimum 4 hours. So if someone can't afford 4 hours of care, you don't get care. And so with scale, if you have that sort of broad, larger base of customers, care pros, and taking all that inefficiency out of the system with technology, you can send someone out to a home for an hour, like we do now. You can send someone out for an hour in the morning to help them with morning duties like getting out of bed, brushing your teeth, and we can send someone out during dinner time to help them make dinner. And so the backfill issue, I can't get someone who speaks Mandarin, not allergic to cats, can do sesame, and can lift a 300-pound man. Like, you just can't do that if you have 10 care pros in a local agency when the scheduling's done by one person inside her head. And if she gets sick, you're screwed. So I think for us, in order to change the industry, you have to have scale, otherwise it's just not going to work, which is why the industry hasn't changed in 30 years. And so for us, you can also have better economics. So if you have a swath of people who can do companionship, but they can't do bathing, sure, why don't you charge less? So then you can have someone out just having to have conversations with your parents 3 times a day for an hour each at a lower price than someone who can do the full swath of bathing, dressing, bathroom care, grooming for a lot higher price. So there's also these sort of economies of scale that you can get just in terms of consumer access as well.
So we've got two ways, I guess, scale. One was I mentioned working with companies like Humana that have their own coaching programs in place, and so we train their coaches, which obviously allows us to get it out to a lot of people that would not necessarily have access to our program. But then also exactly what you guys both were saying too, in terms of using the technology to make our coaches super efficient and effective in the minimum amount of time necessary to talk to a kid and still feel like they're getting one-on-one attention. They feel like all of their issues are being addressed. The parent feels like their questions are being addressed. So finding out what that point is and also staying within our business model so we can scale. So we did, that's what we've been figuring out. And for us, coaching time is about 15 minutes. And people sometimes are shocked at that, but then especially people that have, coaches who have been an RD and they have half-hour appointments, things like that. But when you really think about working with a child one-on-one, 15 minutes is more than sufficient. And we're trying to make this really fun and easy for them. And if they have to talk to their Kurbo coach for half an hour to an hour every week, they're not going to want to come back. So we try to just get, just down and dirty, get what we need done. But that means a lot of technology to make them really efficient.
And what beyond, so you're doing child obesity, what are there comparable industries or areas that you see as your next opportunities and actually next opportunities for all of you guys?
We're going to stay in childhood obesity for a while. We're working with the military right now, which is a whole fascinating group of folks that we didn't expect to be working with. So we've got a lot of work ahead of us. We are talking about doing some work with elderly adults because our app is so simple to use. All foods are red, yellow, and green, so you're tracking your red, yellow, and green light food. There's no calorie counting. So we're going to go older, younger, and stay in obesity, I should say, for a while.
I think for us, there are enough seniors in the world that we need to tackle that we're going to stay in seniors for quite a bit. And I think the other thing about what I said before is you can expand the service to people who don't traditionally think they need home care, but they actually do, like a checkup or a drop-in. And maybe you're 65 but just need someone to talk to. And I think that's something that we can play with as well. But we want to help everybody's parents.
Yeah, and I think we're like a 20-person company. I don't know how many people, but you really need to pick. Like, you need to pick the things you can be really great at. So for us, that's not just like we're going to stay in mental health, but specifically follow the evidence of cognitive behavioral therapy and the conditions and symptoms that we know that we can effectively treat because there's evidence to support that. So for us, it's stress, anxiety, mood, depression, relationships, interpersonal, and doing those because and again, the market's big enough. Because we're all stressed out. At least I am up here right now.
And your coaches are all contractors? Is that how you do the relationships?
We have a mix of full-time and contract. And actually, it's interesting, like when we started, we only were requiring like 1 or 2 hours a week. And while the coaching efficacy was really great, the training time took way too long, and like keeping them trained took way too long, so gross margins hurt. And then on top of that, the efficiency was really slow because they weren't coaching enough time to become efficient. So we're now a mix of kind of part-time contract, 1099, and then also full-time.
We're also a hybrid model.
We're almost all contract.
And how big are your engineering teams, respectively, by proportion?
Like product? Product is, product maybe 60%.
Product right now is probably 40%. The rest are care and marketing and everything else.
I'd say probably 40.
Are there other areas of your? I mean, do you think of the coaches or the care pros as kind of the bulk of the service, or is it the software with the coach or the care pro? I mean, I'm curious about how that kind of internally you kind of think about that component of what you're organizing as a company.
Our app supports the service.
The care pros are the service. and we do everything to help the care pros. So we're in the background.
5 seconds, it's like ticking. For us, it's really actually a blend of the two, and part of it is just saying, they're on the continuum of care. There's therapy, which we don't do, and there's Lantern, which is really training on CBT-based tools with professionals. So it's really just being true to what you are and making sure. I think authenticity and being transparent is really important in these fields, especially as we're doing different things that haven't been done before, and so being very, very clear to the consumer, like what it is that you're providing and what should that expectation be is really important.
Yeah. Well, this is, you guys are all doing amazing work. I think it's a really powerful model that is going to start changing a lot of stuff in healthcare in the areas that you're working in and more. And I think you're all providing a lot of inspiration to many entrepreneurs out there. So thank you so much for joining us today.
Thanks.
Thank you.